Welcome back to Between Bells, everyone. As unemployment numbers are continuing to rise, more and more people are facing financial hardships as well as an extraordinary mental health burden. Our next guest is trying to support those who are struggling by reducing stress and providing simple tips for mindfulness in this uncertain time by giving unemployed Americans free 1 year subscriptions to their company. Joining me now is Dr. Megan Jones Bell, Chief Science Officer at Headspace. Dr. Bell, thank you so much for joining me here today. Headspace, of course, provides mental health tools digitally to their customers, but how have you seen interest pick up during this pandemic?
Thanks so much for having me. We've really seen a surge in demand for our mindfulness and meditation solution. We find that people are using our stressed and anxiety oriented content about 10 times more during this pandemic than they were previously. So demand is really on the rise, and we're fortunate to be able to provide a solution that does have demonstrated efficacy for helping people reduce stress, improve resilience, reduce irritability, and improve overall sense of well-being.
And of course, as a company, Headspace trying to offer these really wonderful and necessary services, but it's also a business. So, can you walk us through some of the decision making behind providing this free 1 year subscription to those who are unemployed?
Absolutely. Headspace was created to improve the health and happiness of the world. And we've always wondered if people who need Headspace the most can't afford it, that's really never made sense to us, which is why over the years we've offered free subscriptions to educators, healthcare workers, and others via our charitable partners. Given the staggering rise of unemployment and the considerable impact that unemployment has on people's mental health in particular, we decided to make the commitment last week of providing free access to a 1 year Headspace subscription for all unemployed people in the United States, really with the goal of helping support and mitigate the psychological effects of a rising jobless rate. Today, we also unlocked 6 new meditations in the app and a featured collection that's called Living Through Unemployment. And includes meditations around adapting to sudden change, sadness and loss, recovering confidence, and finding purpose. So all Americans who are unemployed can register at headspace.com/unemployed. And it's really the ongoing support of our members and partners that make this possible. So we're really happy to be able to share this benefit more broadly.
And for this living through unemployment service that you just mentioned, I'm curious what the process is in terms of, from a scientific standpoint, in terms of gathering feedback, really putting these protocols, these processes together to make sure it is helping those who are unemployed to the greatest extent that you absolutely can.
It's a great question. So for us, everything starts with really understanding our end users, who we call members, their needs, their conditions, and really designing around those end member needs. We then turn to science to inform how we design our content, and then also take that extra step of validation. And so in this case, we have done a lot of research with our members and our target audience of those who are unemployed or who are anxious about, holding on to their jobs. And so the design of this content is really pulling in our best practices. We do recommend that people start with our basics content. That is onboarding to meditation course. It's designed to help people who are new to the practice really establish that foundation. And that basics course alone has been shown in our research studies to help reduce stress and improve people's management of anxiety.
In addition to people who are unemployed, Headspace has also created partnerships with New York Governor Andrew Cuomo, Michigan Governor Gretchen Whitmer to provide your services to their residents. What was some of the calculus behind making these partnerships, and what is the mission there?
The mission is really to provide as broad of access as possible. We are really trying to do our part. We have something that is proven to help people, and we are determined to make it broadly accessible right now. We have had inbound interest from the governors whom you mentioned, and wanted to partner with them to support their efforts to provide evidence-based mental health resources to a broader population. We've also unlocked curated content called Weathering the Storm that's available on our website to everyone. This work has also been global. So that curated content I mentioned has been translated into multiple languages. We've also partnered with the NHS to make Headspace free to all of their employees, as well as make Headspace free to healthcare professionals in France.
Dr. Bell, lastly, of course, having these digital mental health services increases access, maybe increases affordability of these kinds of services. With people struggling financially to a greater extent right now, how do you kind of foresee digital mental health services coexisting with in-person therapists and how that's kind of going to shake out over time?
It's a great question. For us, the we believe that the solutions that are out there in terms of in-person therapy simply are not accessible in the way that they need to be, and based on our research, there simply are not enough therapists to meet the demand, and so it's very critically important that we figure out ways of making evidence based, and I'll stress that point. It's really about science backed mental health solutions as broadly accessible as possible. While it's extremely important that people seek specialty care if they have a diagnosable mental health condition, there's great evidence that self-help approaches are effective. We've shown that Headspace is effective in over 26 of our published research papers, have many more ongoing. But it's really this complement of engaging in healthy routines that can last a lifetime. And that's really where meditation and mindfulness fit in, is something that you can do both while you're experiencing the symptoms of a mental health problem, but also to really increase and maintain your resilience to stressors thereafter. This is something that's beneficial for all of us across our lifespan, regardless of what's going on, and has been shown that it can buffer the impact of some of these stressors.
Dr. Bell, thank you again for your time and thank you for your insight today. That's Dr. Megan Jones Bell, Chief Science Officer at Headspace.